You've reached the site of the Family Nurse Practitioner and Emergency Care program from the Rutgers School of Nursing. Greetings, my name is Dr. Mary Kamienski. I'm the Specialty Director of the FNP and Emergency Care program. Let me tell you a little bit about the history of this program. In 2008, or actually 2007, I convinced the federal government that there was a shortage of emergency care providers in New Jersey and in fact across the nation. They gave me a big grant for me to develop this educational program. I started out with one student. She is still working in Hackensack Hospital as an emergency nurse practitioner, and she was my first star. This May I graduated 12 more students. We have a total of 52 graduates from the program, and the present track has 52 active students in it. Each cohort of students is usually about 10 to 12. There are 9 programs in the United States that prepare advanced emergency nurse practitioners. Rutgers School of Nursing is the only program in the Northeast region. Students in the program may live and work in any state. You can live in New York, you can live in Pennsylvania, you could actually live in Colorado if you want, but it's not an online program, so the commute would be wicked. The one caveat is that clinical hours in the program are restricted to New Jersey. We can only place you in emergency care areas in New Jersey, and that we can't cross the river either side. But that is because the higher education boards in these other states really want to restrict their sites for their students, and that's understandable. To be eligible to be in this program, you need to be actively employed as a registered nurse in an emergency department. You must have a New Jersey RN license or have applied for one. Certification in emergency nursing is recommended. If you've been in emergency RN for 2 years or more, you need to take this exam. It will really enhance your practice, and it looks very good on your resume. You are required to have an active BLS, ACLS, ENPC, or PALS certification. That's fairly common for all programs. By the time you are ready to take the emergency acute care courses, which are at the end of the program, you will have at least 2 years experience in an ED. So you could come in fairly inexperienced, but you must continue to work in the emergency care environment. This is a Doctor of Nursing practice program. It's not a master's program. You will earn a Doctor of Nursing practice. In addition to clinical courses, you'll take courses related to your Doctor of Nursing practice project. Some examples of these courses are epidemiology and population health, information technology for evidence-based practice, and social determinants of health. I picked those randomly. There are other courses, but I like these a lot, so I thought I would tell you about them. Your DNP project will focus on the advanced practice provider role. You will have to develop a project that is focused on advanced practice, not the RN at the bedside or stretcher side, but on advanced practice. Sometimes we have DNP projects that are RN projects, but they impact the advanced practice provider role. There's plenty of topics. It's not to worry about. Upon completion from the program, you will have a doctorate as a nurse practitioner. This young lady you see there with her dog just graduated in May, and having a dog helped her get through the program, and she has passed her FNP already. She has a fellowship, a postdoctorate fellowship that she will be starting in September, and she will be taking the ENP exam shortly. You will be eligible to take the Family Nurse Practitioner certification offered by ANCC or AANP when you complete. It doesn't matter which certification board you choose. It's up to you. Upon successful certification as an FNP, you will then be eligible to take the Emergency Nurse Practitioner Certification exam offered by AANP. That is only offered by AANP. They have developed this exam, and then you can become an emergency nurse practitioner. Our graduates have a 100% pass rate on the FNP certification exam as well as the ENP exam. The ENP exam has only been around for about 2.5 years, so not everyone has taken it, but those who do take it from our program absolutely pass it. The program can be completed in 3 years full-time, 4 years part-time, or 5 years part-time, whatever you can do. The majority of the students in the program are part-time students and continue to work in the emergency department as an RN. And most of the time, pretty much full-time RN, so that you can get the benefit of tuition reimbursement. Even though it's not a lot of money, it's something. Some people are just working part-time, some work per diem, but they're working in the emergency department. Many of our students are married. Many are married with children. Many come in single and get married. Many are married and don't have children and then have children while they're in the program. So we have a wide variety of students. Some of our students even have a social life, which is wonderful. The clinical courses are designed as advanced clinical experiences to help you work as an advanced practice provider in an emergency department. You will be prepared to work in the main emergency department, fast track, any specialty areas including pediatrics, psychiatry, or trauma. As a student, you will be assigned to work in an ED in New Jersey. As I said before, we can't cross the rivers. We stay in New Jersey for clinical. Your clinical experiences are not observational. They're not shadowing. They are hands-on. You take care of the patients. You assess them, come up with a plan, order the plan to be the diagnostics, and you come up with a treatment plan. You will do some primary care hours, 135 per semester for 2 semesters, and the emergency care hours are 225 per semester for 3 semesters. You'll also have opportunities to experience the following. Ride along with the paramedics, and even if you are a paramedic, unless you worked in Newark, you're going to take a shift because Newark is so unique. Labor and delivery to learn how to deliver babies, orthopedics, fast track, trauma, radiology. We focus kind of on chest, abdomen, and extremities. And the medical examiner forensics, there's a day with the observing an autopsy with the forensics medical examiner, and everybody loves it. And then there's toxicology, a day spent in the poison control center, and everybody says, oh, poison control, but they come away wanting more. It is so interesting. Clinical hours, as I said, a total of emergency clinical hours, which include the primary care hours, are 945 hours. You will also do DNP hours, 500. They're not necessarily clinical. They're related to your project. Placement for primary care hours will be arranged by you and the director in a primary care environment, private office or a clinic, different areas. The emergency acute care placement will be done by the program director. You will be placed in an emergency department in New Jersey. As I said, the clinical experiences are restricted to New Jersey sites. Before you begin the emergency acute care courses, you will take advanced physiology, advanced pharmacology, advanced health assessment, child health, adult gerontology, primary care theory, and practicum 1 and 2, and you will end with emergency care theory and practicum 1, 2, and 3. This is not an online program. Some lectures or courses are online. Some courses are teleconference classes, so they're synchronous. Some are face-to-face classes. Some classes will be held in our state-of-the-science simulation lab. There's a wide variety of opportunity for these different classes. The emergency courses are generally taught on teleconference synchronously because we have students from all over the state and from out of state, and that means they can attend classes from their home and in their pajamas or doing whatever. So that part of the program generally is teleconference and probably going to stay that way. Graduates are employed in various positions, which include the emergency department, urgent care, primary care, hospitalist, occupational medicine, faculty, teaching, management, continuing education. Now people have been moving into forensics. There's a wide variety of opportunities for employment. One of our graduates has worked for several years as an advanced practice NP in a large suburban emergency department in North Jersey. She also continues to ride on the hospital helicopter service. After completing her DNP, she has moved into academia and is on faculty, but she continues to practice as an advanced practice nurse. One of our graduates designed and built an urgent care center in New York State. He's the president of and owner of the facility and has another primary care center in the same area. He's presently building another urgent care center in New York. He comes and does guest lectures for us. He's an amazing man, and he's very talented. Where will you be in 3 to 5 years? There are so many opportunities. If you want more information about the program, you may contact me at kamienma@sn.rutgers.edu. Don't text and don't call. Contact me by email. There are also graduates and current students from the program ready and willing to talk to you about their experiences. This young lady is a student right now, and she's in Emergency Care 1 and having a great time. I'm very glad you came to visit us, and again, if you need any more information, please contact me.